Welcome to Shah Medical Surgical. In today's video, we're diving into a common yet misunderstood health issue, our viral fever. From what causes it, to how it spreads, how to treat it at home, and when to seek medical help, this video will cover it all. Whether you're a medical student, a patient, or someone caring for a sick loved one, this guide will give you the clarity you need. So stay with us till the end to protect yourself and your family from the next viral outbreak. Introduction. Viral fever is a common illness that appears mostly during seasonal transitions, especially during monsoon and winter. It is caused by a viral infection that triggers the body's immune system to raise the temperature. This condition affects people of all age groups, from children to the elderly. Although usually not serious, it causes discomfort and can disrupt daily life. What is viral fever? Viral fever refers to a group of viral infections that present with an elevated body temperature. It is a symptom, not a disease itself, caused by different types of viruses. These viruses attack the body and cause inflammation and immune response. It often spreads from person to person through droplets or physical contact. Common viruses causing it. Several viruses are known to cause viral fever. The most common one is the influenza virus. Other viruses include dengue virus, which spreads through mosquito bites, and the COVID-19 virus. Adenovirus and enterovirus are also responsible for respiratory and stomach-related viral fevers. Each virus presents slightly different symptoms, but fever is a common factor. How does it spread? Viral fever spreads mainly through respiratory droplets released when an infected person coughs or sneezes. Touching contaminated surfaces like doorknobs, mobile phones, or utensils can also spread the virus. Close personal contact, like hugging or sharing food, increases the risk of infection. Maintaining distance and hygiene are key to stopping the spread. Key symptoms of viral fever. The most prominent symptom is a high-grade fever, often above 100 degrees Fahrenheit or 38 degrees Celsius. Other symptoms include body aches, chills, and extreme tiredness or fatigue. Many patients also experience headaches, sore throat, or a dry cough. These symptoms can develop suddenly or over a day or two. Other possible symptoms. Some people develop a runny nose or nasal congestion due to respiratory viruses. Loss of appetite and mild stomach issues like nausea or loose stools may also occur. In viral fevers like dengue or chikungunya, skin rashes and joint pain are common. The variety of symptoms depends on the type of virus and the patient's immunity. Duration of viral fever. Most viral fevers resolve within 3 to 5 days with proper care. In some cases, it can last up to 7 days, especially if the body is weak or immunity is low. Recovery is faster in healthy individuals who rest well and stay hydrated. If the fever continues beyond a week, medical consultation is necessary. Difference from bacterial fever. Viral fevers are caused by viruses and usually resolve without antibiotics. Bacterial fevers, on the other hand, need proper diagnosis and antibiotic treatment. Viral fevers often bring more fatigue and muscle pain, while bacterial infections may have localized signs. Only a doctor can confirm the difference through symptoms and tests. Who is at higher risk? Young children and elderly people are more vulnerable to complications from viral fever. Patients with diabetes, heart disease, or chronic illnesses are at higher risk too. People with weak immune systems, such as cancer patients or those on steroids, need close monitoring. Pregnant women should also be cautious and consult a doctor early if fever appears. Viral fever in children. In children, viral fever can develop suddenly and rise very high quickly. Symptoms may include extreme irritability, reduced feeding, or constant crying. Children are more prone to dehydration during fever, which can become dangerous. Parents should monitor urine output, activity level, and signs of lethargy. Warning signs to watch. Seek immediate medical help if the fever remains above 103 degrees Fahrenheit or doesn't subside after 3 days. Difficulty breathing, rapid heartbeat, or chest tightness are serious signs. Persistent vomiting, diarrhea, or refusal to eat or drink also require urgent care. If there are seizures, confusion, or a child becomes drowsy, visit a hospital immediately. Home care, first steps. Begin with complete bed rest to help the body focus on fighting the virus. Hydrate frequently with water, juices, and ORS to avoid dehydration. Eat light meals like soup or khichdi to support digestion and energy levels. Keep the room airy and maintain personal hygiene to speed up recovery. Fluids that help. Drink lukewarm water throughout the day to regulate body temperature. Coconut water is rich in electrolytes and helps in maintaining hydration. Fresh juices like orange or apple juice provide vitamin C and energy. Oral rehydration solution, ORS, is especially useful if there is diarrhea or vomiting. Foods to eat. Eat easily digestible food like khichdi, oats, or boiled rice with vegetables. Fruits like bananas, apples, and papaya are gentle on the stomach and nutritious. Boiled vegetables with salt and a little oil are safe during recovery. Avoid fried, spicy, or heavy foods that burden the digestive system. Medicines to use. Paracetamol is the safest medicine to control fever and relieve body pain. Do not use antibiotics unless prescribed by a qualified doctor. For cold symptoms, antihistamines or decongestants may be recommended. Children should only receive age-appropriate doses under medical supervision. What not to do. Avoid taking random antibiotics, as they do not work on viruses and cause resistance. Don't send a recovering child to school too early, let them rest completely. Avoid giving cold baths during fever, lukewarm sponge bath is safer. Never ignore continuous high-grade fever, consult a healthcare provider. Natural remedies. Tulsi leaves boiled in water can help soothe the throat and fight infection. Ginger tea or honey mixed in warm water provides relief from cough and cold. Steam inhalation helps in nasal congestion and breathing issues. Warm salt water gargles can ease a sore throat effectively. Rest is essential. The body needs complete rest to build immunity and fight the infection. Avoid watching screens or using mobile phones for long periods. Stay indoors, especially during the contagious phase, to avoid spreading it. Resting properly helps in faster recovery and avoids complications. Hygiene tips. Frequent hand washing with soap or using hand sanitizer helps prevent infection. Avoid touching your face, eyes, or mouth with unwashed hands. Wear a face mask if coughing or sneezing to protect others. Never share towels, utensils, or water bottles during illness. When to see a doctor. If fever continues beyond 3 days or exceeds 102 degrees Fahrenheit, consult a doctor. Unusual symptoms like severe body pain, chest discomfort, or rashes require medical attention. A child who refuses to eat or shows signs of dehydration needs urgent care. Sudden weakness, fainting, or breathing problems should never be ignored. Investigations may be needed. Doctors may recommend a CBC, complete blood count, to check for infection. If dengue or malaria is suspected, special blood tests are required. In case of respiratory symptoms, a COVID-19 test may be done for confirmation. These tests help rule out serious infections and decide the right treatment. How long to stay home? Patients should rest until the fever and weakness are completely gone. Even after recovery, wait 2 to 3 days before returning to work or school. This reduces the chance of spreading the virus to others. Pushing too early can delay recovery and cause relapse. Prevention is better. Build your immunity with a healthy diet, enough sleep, and regular exercise. During outbreaks, avoid crowded areas or close contact with sick individuals. Practice good hygiene like hand washing and proper coughing etiquette. Vaccination against common viruses, like flu and COVID-19, also helps. Can it be dangerous? While most cases of viral fever are mild, some can turn serious. Dehydration, especially in children and the elderly, is a key risk. In rare cases, viruses may affect the brain or internal organs. With early care and monitoring, complications can usually be prevented. Final summary. Viral fever is usually self-limiting, but it requires attention and care. Recognizing symptoms early and taking rest ensures quick recovery. Always monitor warning signs and consult a doctor when needed. Prevention through hygiene and strong immunity is your best protection. Thank you for watching this detailed guide on viral fever. We hope you now understand the symptoms, causes, treatment, and prevention better. Don't forget, most viral fevers are self-limiting, but timely care and hygiene are the real weapons. If you found this video helpful, like, comment, and subscribe to Shah Medical Surgical for more trusted health education. Stay safe, stay informed, and we'll see you in the next video.